Just because it's common does not mean it is normal. In the pelvic health world, I always say TMI is my jam. It is the too much information is never enough information for me. I want to talk about your bowels. I want to know what they look like. I want to talk about how easy it comes out of your body. I want to talk about sex. I want to talk about your vagina. We want to talk about your bladder and your pee. We're talking about all of these things that most people are too embarrassed to actually talk about. But if you are having dysfunction in these areas, it is 100% affecting your life. And that is why I do what I do.
Millions of women are living with pain, discomfort, and silence, told that it is just a part of life. It doesn't have to be. This is Healing at Your Core, where pelvic floor physical therapist Bree Allred brings more than 20 years of clinical expertise to the conversations women deserve to have. Real answers, real healing, no shame. And now, your host, Bree Allred.
Hi, I'm Bree Allred. I'm a pelvic floor physical therapist of 20 years, and I am so excited to be talking with you today. I started in physical therapy because I really have loved the medical field, but I did not like blood. I would pass out. So this was a really good fit for me to be able to be a physical therapist and have my feet in the medical world and not have to deal with any blood. I really have become very passionate about pelvic health. I'm a pelvic rehab practitioner certified and have really made this my life's passion over the last 18 years in my career. It is something that we need to talk about that people don't talk about. I started my career in a clinic where I did a lot of work in the spine clinic, and I was the only female therapist at the time. And so I ended up getting to work with all the pregnant women who were having troubles during their pregnancy with back pain and pelvic pain. And that really started my journey in treatment of pelvic floor issues. I have since then really made this, it is 100% what I do with my career, and feel that it's been just a gift of mine to be able to connect with people on these levels and make uncomfortable things comfortable and to do so in an environment that is safe for people. So I'm hoping that's what we're going to create on this podcast. I want women to know about these things. This podcast is for women ranging anywhere really from 16 to 80 years old. The pelvic floor is especially pertinent to women because we go through a lot of hormonal change when we very first meet our period. And then as we go through a season of childbearing, our body has another big hormonal change. And then we deliver children. We go through childbirth, whether that's through a C-section or a vaginal delivery. And then as we go through menopause, again, we have another season of a hormonal change in our life. And the pelvic floor is especially sensitive to all of these changes. We're doing this podcast because we really want to educate women. And this is one of the best platforms that we know to get that education out there to people of all ages and to be able to start conversations that normally wouldn't be started and hopefully help just grow everyone's awareness so that we can stop treating common things as normal. Just because it's common does not mean it is normal. In the pelvic health world, I always say TMI is my jam. It is the too much information is never enough information for me. I want to talk about your bowels. I want to know what they look like. I want to talk about how easy it comes out of your body. I want to talk about sex. I want to talk about your vagina. We want to talk about your bladder and your pee. We're talking about all of these things that most people are too embarrassed to actually talk about. But if you are having dysfunction in these areas, it is 100% affecting your life. And that is why I do what I do. So let's delve into why is the pelvic floor pertinent to all of these TMI questions that I just asked about. So this is our pelvis. It would be sitting down lower in my body, but the striated red here is all of the pelvic floor muscles. A picture is always worth 1,000 words, right? But as we're looking at this, you can see here at the front in the pubic bone, we've got pelvic floor muscles that attach there. And they're almost like a bowl of muscles that go around and attach at your tailbone in the back and in the two bones that we sit on here on our sides. There are 3 different layers to the pelvic floor. These layers work together to help us with function. So the outside layer has a little bit more circular nature. These circular muscles play a big role in the sphincters, if you guys have heard of that, right? We've got like the anal sphincter. We've got another one that's around the urethra that's in the middle layer. They play a big role in sexual function as well, and helping us to be able to orgasm or to be able to have penetrative intercourse. The deeper muscles are a little bit more postural, a little more supportive, and they do lift and help close openings as well. So as you can see, we're surrounding urethra, we're surrounding vagina, we're surrounding the anus. And that in and of itself really leads to how it interfaces with our bowel, with our bladder, and with intimacy issues. Now, another role of the pelvic floor, the fun one, you can see how it's going to be integrating with your pelvis and how it's going to be integrating with your spine and your tailbone and how also it integrates with your hips. So if we have pain in your back that's not getting better, this might be a culprit. If we have pain in your hip that is just not getting better through standard methods, you've gone to physical therapy, you've seen multiple physical therapists, are they looking at the pelvic floor and the contributors to that? We're also talking tailbone pain can be a big thing that did you know you can do something about it? Can also be very helpful. These muscles also integrate with our deep core and it works as a canister. So if we're thinking of a canister, the pelvic floor is the bottom of the canister. If I'm coming over the top right here into our rib cage, we would be looking at the diaphragm muscles. And then we've got the abdominal muscles in the front and the back muscles in the back. And that's really what we talk about when we're talking about our deep core. And so deficits in the pelvic floor leaves a weak area in the core canister. With our core canister, I want you to think of a soda pop can. It's pretty strong, right? Especially when it's unopened. Now, if you pop the top, it's much, much easier to collapse. So, pelvic floor, if it has a weakness, it's the weak link. It's like popping the top on the core canister. Okay, and it makes it much easier to collapse. And that's a lot of how it's going to be relating to your spine, to your hip, and to your pelvis as well. Now we're looking at the pelvis with the organs in it. So we've got your bladder here in the front. We've got the uterus as it comes over the top. We also have these two fallopian tubes with the ovaries at the end of them, and your bowel as it's exiting the body right there at the back. So when we have a lot of pelvic pain, we're going to be looking at what all of these structures in here. We're going to be looking at what's happening in the bladder, what's happening in the uterus, what could be happening in the ovaries, what's happening in the bowel. So pelvic floor is going to encompass all of these. And a pelvic floor therapist is going to also be looking and having some extra knowledge with these organs here. Males, I did not forget about you. Here you go. We have a bladder here in the front. We have your bowel in the back. This is your genitalia as it comes out. Okay. I'm going to put this person on their back. And now you can see the male pelvic floor. We have all of the same structures organized a little bit differently in our body. Okay. It's an interesting kind of thing that we think about. But if you're looking at muscles from a male's perspective and a female perspective, do you see the similarities? The same muscles exist. They're just organized a little bit differently. Okay. We can also say males have a urethra. Females have a urethra as well. Okay. The males is generally external. Females is more internal. Okay. We have a penile head right here. We have a clitoris in the female body. So similar parts organized a little differently. Males have a prostate. Females have a uterus. Similar, okay, helping with reproduction, but organized a little bit differently. Are we seeing this? It's like males have a pelvic floor too. They're just less likely to have dysfunction. They're not going through as many hormonal changes within a month or within a lifespan, and they're not delivering babies out of here. So their dysfunction is less often. Females, we have it more often. But if you have a husband with testicular pain, if you're struggling with penile pain, if you're struggling with groin pain, hip pain, all of those things, the same could still be happening from our male counterparts and could have issues as well. I will date myself just a little bit, but if you've ever seen the movie Kindergarten Cop, they talk about
boys have a penis, girls have a vagina.
Right? And that's kind of how we're taught about our anatomy. But let's actually talk a little bit more about the external female anatomy. Okay. This would be sitting in my body right here is the back, and this is the front. So this person is laying down on their back. But what we're looking at here on the outside is actually called the vulva on a female. Okay. So the vulva, here we've got the labia. Okay, majora on the outsides, labia minora on the insides. We'd have the clitoris here up at the top, and then the actual hole at the bottom is the vagina. So it's not just a big, do you know what I mean, overall vagina, right? When we think of boys have a penis, girls have a vagina. But we're really talking, it's like vagina is the hole, and the vulva is what we're actually thinking of when we're talking about our private parts or our external genitalia. Now, let's specifically talk through how the anatomy can then lead into some of the symptoms or things that you might be having in your pelvic floor and how we may go about treating that. So, we could have bladder issues. Bladder issues can occur with difficulties in the bladder itself, difficulties within the urethra. I guess you could even say up the chain a little bit in the kidneys, where if we have a kidney stone, you could get some pain in these areas as well. And then it can also have dysfunction within the pelvic floor. The pelvic floor can either be too tight and it can cause issues with being unable to empty your bladder well, or you sit down and you're like, I can't pee. I know I need to pee, but I can't pee. That can be one sign or symptom there. It can also cause urine leakage if these muscles are too tight. So that can be a big issue there. I have women that feel that they have recurrent UTIs or chronic UTIs, and then they go into the doctor, they get their urine tested, and there is no infection. So then why are you having these UTI symptoms? Guess what can be the culprit? These pelvic floor muscles. If they're too tight, it can create some of those burning sensations, that having to go to the bathroom often, getting that urinary frequency. So that can be a symptom there. Another thing that we will have is having to go to the bathroom often with strong urgency. Pelvic floor muscles can be a part of that, whether they're too weak or too tight. That can both feed into it. There are some things within the bladder, whether it be hypersensitive nerves. Sometimes there's conditions called interstitial cystitis or a painful bladder syndrome that can be a factor within the bladder itself, or some nerves in the bladder itself that can be a problem. We can also have the muscle that's around the bladder become a little bit overactive as well. And there are some strategies that we can do with physical therapy to be able to help that as well. Now, moving on to the uterus itself. What are some problems that could happen within the uterus? Really, these are going to be things like adenomyosis or endometriosis, can be things that are growing here. We'll do a special episode to talk just about that in and of itself. But endometriosis can cause a lot of pelvic pain. And oftentimes there's a lot of muscle tension that's associated with that as well. From a bowel perspective, we have two ends of the spectrum. We have constipation, where you're really struggling with being able to empty your bowels, or we have incontinence, where it's like, I can't control my bowels. And so we may be having some accidents there. With that, pelvic floor is we like to call it the doors. Those are the doors that are controlling when things exit and when things stay in. So if you had a door that wouldn't open well, could you see how that could contribute to things being unable to come out of the body? AKA, you're constipated. You're having to strain to have a bowel movement. It's a workout to go to the bathroom, or you're feeling very bloated, just not well. Do you know what I mean? Very full in your stomach. That can be from the pelvic floor. And if it's weak, if the doors are open all the time, it makes it really hard for things to stay in the body, right? So then we can work with that as well. We can work with bowel urgency. There's so many different things that its pelvic floor can encompass. Are you starting to see? It's a central hub of your body. This is where we talk about its healing at the core, right? This is where we're really addressing, it is a center spoke, the center hub of do you know what I mean? All of these wheels and spokes that come in on a wheel. If you're looking, it's like we've got the legs are coming into this, and it's transferring that force up through into your trunk. It's also transferring force from your arms down to the ground. So it is a really big central hub where things are absorbing forces, where they're transferring forces. It's very complex and it's very crucial to our lives. Now let's talk a little bit about intimacy. Okay. We can have issues with being able to have these muscles relax enough or having enough size or stretch to be able to allow penetration. This can also be like painful tampon use. I may have clients who have struggled with some traumatic experiences in their past, that these muscles are remembering what's happening there and they're trying to protect your body. And that can be an issue that we could have. There's also some women, just in our culture, I'm in Utah, so we have a very predominant religious culture here. And That religious culture is based around a belief that we should wait to have sex until we're married. Now, in a lot of individuals, all of a sudden getting married doesn't switch the education that you've had before marriage. And so inside, you still have a little bit of a belief that it's wrong and that it's not okay, even though you know it's okay, but you don't think it's okay, right? Because your teaching, your education, your belief up until that point is that it's not okay and that it's a sin if you do it beforehand. And so we may have some issues with your brain telling your body that this isn't okay, even though you're actually thinking it is. I hope that's not too confusing, but you're seeing the process here, right? It's okay now because you're married, but your history has been that it's not okay. And so your body is responding to the history and the belief that you have. We can work with being aware of the muscle responses, and we can work with what's feeding into those, which oftentimes will need some mental health counseling a little bit or some coaching along those lines as well. And then we combine that with some nervous system training, right? And we can get to where this is no longer an issue for people. It's really neat. Moving up, let's talk about childbirth. Okay. Let's go before that. Let's talk about pregnancy. What happens during pregnancy? You see this little uterus. In most people, it's about the size of your fist. So I want you to just think about that. So if you're a little bit bigger person, your uterus might be a little bit bigger, right? But your uterus is about the size of your fist. Then during pregnancy, there are huge changes that happen in your body. For the first 12 weeks, we get a huge hormonal change. We are skyrocketing several hormones in your body. Estrogen skyrockets, progesterone skyrockets. But there's another hormone called relaxin. That's not all of them, but that's why we get sick for the first 12 weeks, is your body's like, whoa, there's a huge uptick in what's happening. Then your body is also increasing blood flow by about 40%. Isn't that crazy? So you're 1.5 timesing the amount of blood that you have in your body. Your uterus is going from the size of a fist to at least the size of a watermelon and usually a little bit bigger. Okay. Significant changes there. We're stretching the abdominals. The pelvic floor is now having to carry all of that weight from the increased blood flow from a uterus, from a baby, and from the amniotic fluid that's in there. And it's doing so with hormone changes that are really made to make things loose in the body. Okay. From a ligamentous standpoint, so that your pelvis can actually change, your body can grow and house a baby, and to do so safely without causing any injuries. Then we go through childbirth. There's two ways that baby's coming out of your body. It's either going through the vagina or it's coming out through the abdomen. Both can cause a lot of dysfunction. And this is where I always say, I'm like, my own mother, I remember I think probably a 10-year-old kid that I'm like, Mom, come jump on the tramp with me. And she's, oh, honey, I can't do that. I'll pee my pants. And that was just something that she accepted, that she was never going to be able to jump on the tramp with her kids. And she altered what type of exercise she did. She also, I don't remember my mom ever really going running with us, right? For same reasons. Like it was that whole idea of, I've had a baby now. It's just normal. The reality is, it's not normal. It just means these muscles have never been rehabbed. They stretch, they get cut, they tear. And if we don't do something to help correct it, it doesn't ever come back to normal. I use the example of an ACL surgery, right? You tear your ACL, you go through surgery. Where are you? Almost immediately after. You're in rehab. Why? Because those muscles don't wake up and they don't get back to the full strength without us actually working on them and doing something about it. So it can be a huge thing when it's like all it takes is just re-educating these muscles how they should function and what they should do. Another issue that can happen is prolapse as we go through delivery of a baby, but even just carrying a baby and the pressures that are generated during that time frame of our lives, we can have something called a prolapse occur. If you've grown up on a farm, you likely know what a prolapse is. It happens in animals and it can also happen in humans. Really, what it is, we've got these three organs. Okay, we've got the bladder, we've got the uterus, and we've got the bowel back there. They are nice and suspended in this pelvis. And we've got the pelvic floor muscles that can help with that. And there's some ligaments on these organs as well that help hold them in place. When there is downward pressure for a prolonged period of time, whether that be for pregnancy or with pushing for a delivery, or sometimes if there's complications where you need to have a vacuum or forceps, this is a little more likely. But these organs can fall into the vaginal canal. And oftentimes women will say, it feels like there's a bulge in my vagina, or I feel like I'm walking around a golf ball. Those could be some symptoms of that. A lot of it is just a lot of pressure within the vagina, but the bladder could fall back, the uterus can fall down, or the bowel can fall forward into the vaginal canal. And that's another condition that pelvic floor therapy can help with. So that's a really fairly thorough introduction of the pelvic floor, the anatomy, who I am, and what we're hoping to educate a little bit more on throughout this podcast. We have some screenings, a screening questionnaire available. So if you're wanting to see if you could be a good candidate for pelvic floor physical therapy, we'll attach it in the show notes.
Millions of women are still waiting for someone to take their symptoms seriously. You found this show. Share it. New episodes of Healing at Your Core release every week. Evidence-based, non-surgical, and built around one belief: you do not have to live with this.